Thank you very much. Hi, I'm Orrin Troum. I'm a practicing rheumatologist in Santa Monica. I'm on the clinical faculty at the University of Southern California in Los Angeles. We're here at the RWCS 2018 meeting in Maui, and Alvin and I just went over some things that we're going to talk about in just a second. Alvin?
Yes, I'm Alvin Wells. I'm a rheumatologist in private practice in Franklin, Wisconsin. Orrin and I just did a 2017 review talking about gout, osteoarthritis, and scleroderma. Orrin, you showed some data about new intra-articular injections. What do you think is going to be one of the things that our rheumatology colleagues should look out for?
There was presented at both EULAR and ACR some new data about potential DMODs, disease-modifying anti-osteoarthritic drugs, that are really exciting. The potential here is to not only increase cartilage growth, but to decrease pain. And some of those look very promising, although they were still phase 1 and 2 studies.
I think it's really exciting because now with osteoarthritis, just like with rheumatoid arthritis and psoriatic arthritis, we're looking for structural changes. No longer is it just good to help their pain and their function, but we're looking for cartilage growth, and that's why some of these new small molecules you talked about as well. From my perspective, I think it's good news and bad news. We talked about maybe some of these intra-articular injections might not work as well as we think, but we also talked a little about opiates. I know, Orrin, this is something you talked about in the past. What are your take on opiate medications for treating OA?
So there was a very nice study that was done that really looked at the use and really overuse of opioids, and there was a particular section of the population, younger women, less than 65 years old, that were getting spinal osteoarthritic surgeries that were most likely to overuse opioids. And so we really have to be careful about the use of opioids and potential for overusing them and for overprescribing them.
And we shared some of this too with the link also on the website as well. Some other things we kind of feature looking at what's new for exercise recommendations, and also as we get into scleroderma. It's a challenging part. We don't have any great disease-modifying medications, but some phase 2 data looking at subcutaneous tocilizumab might be the first hint that there's something that's going to help for our patients with lung disease and also skin involvement from scleroderma. So I think it's kind of exciting. So I think overall, Orrin, your take-home message, so for osteoarthritis, gout, and scleroderma, what are some things that really our colleagues can use to use them really tomorrow in the clinic?
The other aspect of our discussion was really about gout and the fact that there is such an increase in comorbidities associated with an increasing rate of gout in the United States. And so to target those patients and to really make sure that we are reducing their weight and having them exercise not only for osteoarthritis but also for gout, and some of the newer therapies for gout that are really outstanding, in particular in reducing the tophaceous deposits like pegloticase and other newer therapies that are on the horizon.
I think it's just an exciting time for rheumatology and exciting to be here for RWCS 2018.
Thank you very much.
Thank you.